because we have been experiencing for half a century, and even before that, when I was maybe 7, 8 year old, my mother-in-law of my eldest sister, she was chewing tobacco, Manpuri tobacco. I don't know how many of you heard. Nobody talked about. Even Pawan didn't talk about the Manpuri tobacco. That was famous uh, for oral cancer, and a lot of work was done at Agra Medical College, Agra, ICMR, about that. And she had this cancer, and she died of that cancer. One day, an outpatient, there was Manoj Pandey was his name, member of parliament, son of Kedar Pandey, a politician from Bihar, and he had a ulcer on his tongue, and he was a ardent pan chewer, tobacco chewer, and I took a biopsy in minor OT, and it turned out to be squamous cell carcinoma. Narasimha Rao was the prime minister. Since he was a member of parliament from Bihar, an important person, so he was sent to UK for treatment. I am talking of, you can imagine, 91 to 92. And he died there very soon. Within, I think, 6 months, he succumbed to that oral cancer of the tongue, cancer of the tongue. The third person was a community medicine person. I think nobody is alive today, so I can take their names. Dr. Devki Nandan. He was director of National Institute of Health and Family Welfare, and he was an ardent tobacco chewer, pan chewer, and he developed that, and he also succumbed to that. Another person was in RML hospital, again a doctor, and Subhash Misra. He succumbed to oral cancer, and like that, many. I have seen young lives have been taken away because of this. One of my very close friends, as Pawan is saying, is very true. I developed hate for tobacco because he was in medical college friend and he was addicted to smoking. And at that time, since we didn't have money, so he was using Charminar, chain smoking. When he quit, after many years, once he got coronary artery disease. That's what I was saying, that people do, you ask people to reduce weight, they say, sir, हम तो एक ही रोटी खाते हैं, हमारा वजन तो कम होता नहीं है. As soon as they get MI, myocardial infarction, heart attack, suddenly the weight will come down. Same thing happens with tobacco also. Now we get this Burgers patient, in and out, Dr. Raheja was mentioning, that we ask them to stop, and this is, most of them are BD chewers, BD smokers. They come from rural area, and we'll ask them, बीड़ी बंद करो, एक भी बीड़ी नहीं पीना है, क्योंकि हमने तो छोड़ दी है, कब से छोड़ी है, अब 3 दिन हो गए. So this is the usual story of these quit smoking, those who quit. So it's basically, tobacco is a systemic disease. You cannot dissociate, as Dr. Raheja was mentioning, from head to toe. Any organ of the body can get affected. All cancers have been associated with the smoking, every cancer practically. In India, we also use the phrase that 80% cancers are related to tobacco, and it is preventable, like oral cancer, aerodigestive cancers. Okay, not all cancers, lung cancers are preventable because they are caused by even pollution. Pollution is like smoking. Like our housewives and women house makers were using chulhas, which is now Modi ji has revolutionized by giving them gas connections. So this is a way forward. Of course, this will also help in reducing this, but pollution is also, it's a double whammy basically. Smoking and pollution put together. And we used to have a fight with one of my anesthesia colleague in OT all the time. I mentioned last time also. If you remember, Dr. Sunita Ravi Batra was smoking. So we used to fight. You can't smoke in changing room. If you have to smoke, go on the rooftop. Please, we don't like. And I am basically a little bit allergic to smoke also. So I used to get very uncomfortable. I can make out from a distance that somebody has smoked there. So, and we used to have that, and I think that is very true. Uh, Empathy at some point, but you have to tell these people if they are close to you, because you want their welfare, and that's why I agree with Pawan that that has to be done. So, what Dr. Desai started with, basically his experience, and when I think Anilji, when you shared, Sanjana ji shared the all the publications, I think more than 60-70% were from Dr. Desai, those publications. So he has extensively worked in this, but I think practical approach is needed, and personal involvement is what takes anything to succeed, like Pawan, what he is doing. That is very much needed, and we have to have team, because one person can't do anything. It has to be replicated what Pawan is doing. Train people, because I don't know what to tell these people how to quit smoking. I have spent half a century in this profession, but if I have to counsel someone how to quit smoking, I don't know what to tell them, how to tell them, how they can be. We just tell them plainly, stop, quit. Maybe we are undertaking you for a operation, so stop for 4 weeks, and they will restart after the operation. And many a times, illness does help in quitting smoking. A lot of people quit, they sustain that, but many of them they come back to use tobacco. So I think what Dr. Nimesh's point was that don't try to achieve excellent, so that good becomes a victim. I think that was a very important point, and we all have to continue with our efforts. And even if we can do a little bit contribution, we should accept that, because you can't revolutionize the whole world in one go. Dr. Khilani, I think, enlightened us about his ICMR committee and the white paper, and he very clearly mentioned that the impact of these electronic nicotine delivery systems is also equally harmful. So we cannot say that it is less harmful, more harmful, but question is the ban helping or it is harming? We don't know. I think that is where the challenge lies for all of us. Dr. Bharat Gopal very extensively covered, and he said there are only 10% chances that we must succeed in let people quit smoking, and so, and we have to be. Uh, he mentioned something about tolerance. So I think that is and preventing initiation, assistance, all those things, and reduce risk that will lead to. So, but in theory, of course, we all know that has to be done. But how much we are able to do, how many people are able to do, I think that is the challenge. We can talk hours and hours that what are the harmful effects. We all know. It is nothing new. It's not a rocket science that tobacco is a systemic disease. If we smoke, we chew, it's a systemic disease. Dr. Jayakumar very briefly mentioned, as I am a clinician, so he's a clinician, so we see the end product of tobacco use. And that is where I have seen that as soon as they get heart attack, like my brother-in-law, my wife's brother, he was a smoker, heavy smoker. So he got MI in, I think, 2006. And his son drove to him from Parvanu to PGI Chandigarh, and we were in Cochin at that time, so he was saved. Dr. Talwar was fortunately there, so he did stenting on him, and he has reduced but not stopped even after that. So he still has one or two every day. So that kind of a craving remains for some reason or the other, we don't know, and that's why the research is needed in this direction, why people are not able to do that. Then Dr. Preeti mentioned about non-combustive, and again, she is for ban, but I think we have heard that ban always doesn't work. That also we know that. So that is something, and I think in one of the dental meetings when I attended, they said sugar is new tobacco. That the phrase it is used in dental, this sugar is new tobacco. So that is also we have to remember, and so I think then Dr. Sunita Gupta um, mentioned, and again, Preeti would also see the patients towards the end of the smoking harmful effects. And so all of us experience that. We see burgers, we see cancers, we see cardiac problems. So any system of the body is affected.
So may I request you to wind up, please?
And Atul, naturally, although he is also not for ban, and he extensively discussed psychoactive substances and how we can do that. And he said we must have empathy also. So maybe I think it's that also is an approach with some which can be used to reduce for harm reduction. So we can have multiple strategies basically. Dr. Sunita Mittal extensively talked about the harmful effects of tobacco on the women, the fetus, the neonate, and that also is important. Dr. Raheja again extensively mentioned the campus, if we can make tobacco free. Not easy, but I think, because there are a lot of incentives for smoking. And then Pavan shared his experience. And I think I consider that he is doing great work, because I have experienced with him on his programs. And I think that is the way forward. And as he's saying now, he's replicating in other hospitals, and that is what is needed. Every hospital, and I think from policy circle, you can take this recommendation to the health ministry, that we should mandate from NMC and also from Ministry of Health, every small or big hospital should have somebody who can counsel these patients. And you have these psychologists, you have at least somebody there who can counsel and guide them where they can go and get de-addiction, or if they want help, at least those who want help, if they are coming to these hospitals. Because today, if you ask, many hospitals will not have any kind of a support to support these people how to quit smoking if they really want that, they want to do it. So I think that is something which I would summarize, that it's a systemic disease and it's a social problem. And as I think mentioned by Dr. Heja very clearly, it's a teenagers. And what we are talking about mainly the urban, maybe lower middle class. But if you look at these poor children, rag pickers, they are a problem, because they smoke this tobacco, bidi, whatever they can lay hands on. So the problem is much bigger than what we actually can see. So it's a real problem, and we have to have multiple solutions for it. One solution will not work for everybody. Thank you.